Hi, everyone. I'd like to do a shout out to our sponsor, Bako Diagnostics. Early detection is the single most important factor in improving patient outcomes. The Bako Diagnostics team recognizes how impactful a podiatric physician can be and remains committed to supporting you in your role as the first line of defense in diagnosing conditions of the lower extremity. Thanks to the unwavering support of their clients, Bako Diagnostics has been able to give back to the podiatric community for 16 years by providing podiatric educational resources and advocating for the position. Bako Diagnostics, helping podiatric physicians keep America on its feet. If you have not yet had the opportunity to utilize Bako Diagnostics services, get started today by sending an email to corporaterelations@bakoddiagnostics.com. The first 50 podiatry offices who request a starter kit will receive a Dean's Chat mug. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and co-host for the Dean's Chat podcast. Once again, I'm with my co-host, Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing fabulous. How are the holidays for you?
Holidays were good. It's always nice to have some time together. We did get a sickness ran through our house, so we had a little forced relaxation, which, you know what? Sometimes that's necessary. But we're on the up and up now, so that's good.
Very good. Well, hey, we're kicking off the new year with a phenomenal guest. I'd like to introduce Dr. Alan Ng. Dr. Ng, welcome to Dean's Chat.
Thanks, guys. Appreciate it. Thanks for having me. It's a great honor to be here chatting with you guys, as always. Always fun discussing our profession and all the things going on with it. And I appreciate you guys for everything you guys do.
Well, thank you so much. And we're fairly informal on Dean's Chat. If it's all right with you, let's go first names, Alan and Joe and Jeff.
Sounds great to me.
Well, we really appreciate you ending your long surgical day with a discussion with us about your career, Alan. We'll start with the informal bio like we usually do, but then I'd like to kind of break out some of the different parts of your career as we go through the discussion. So Dr. Ng graduated with a Bachelor's of Arts in Molecular Biology from the University of Colorado with a minor in economics, which I find really interesting because you were also secretary and treasurer for multiple different things. You went on to get your DPM degree from the Scholl College of Podiatric Medicine in Illinois, and then completed your surgical residency program at Harris County in Houston, Texas, followed by a reconstructive surgical fellowship under Sam Mendocino. Currently practicing in Denver, Colorado, and the fellowship director of the Rocky Mountain Reconstructive Foot and Ankle Fellowship at Highlands Presbytery St. Luke's. And we're so excited to have you here. We'd love to start with first, you've been a part of resident education and now fellow education for a long time. And so I'd love to get your take on what have you seen change in the last 10, 15 years in terms of education? And what are you excited about for the future of resident education?
It's been unbelievable. I remember that when I was a resident under Sam and a bunch of my other colleagues, and we had large frag, small frag, screws that were non-cannulated and not procedure specific, plates and screws, and total ankles were like vaguely talked about in Europe, but not really in the US yet. So, over the years, I've practiced for 24 years now, or 25 years now, I guess, and seeing the evolution's been pretty impressive. I started day one out of fellowship in Houston, training residents. I've trained residents ever since, and now training fellows as well. What excites me is innovation and new, better ways of doing things. And, we have the opportunity, luckily, to design things that we want to design to make things better. We have better technology with customs and 3D printing and a lot of things and pathologies that we couldn't really treat very well in the past. We have options now. Yeah. And it's really changed a lot I would say probably the past 10 years has been amazing how fast it's accelerated. And I can only imagine what's going to be after I'm retired in about 5 years, how much more accelerated it's going to be. So I'm looking forward to training the future, physicians that we take our places and try to push them to the limit, to always trying to, be as best as they can possibly be. And the ones that want to do that are the ones I love focusing on and watching them evolve and seeing them become successful in their practices, as well as give back to the profession, whether at ACFAS or whether at ABFAS. That's what makes me excited more so than anything else, is watching the physicians, young physicians I train and teach, watching them become successful. That's better than any fancy 3D printed total ankle, in my opinion. So that's what really makes me excited.
I love that. Jeff, your
Well,
thoughts?
well said, Alan. So you've got a busy surgical practice. December is usually a very busy time, and I mean you're actually at the hospital as we speak.
Yep.
Yeah, we often talk about busyness in December. What was your December like?
It was brutal. So I think January is now the start of vacation for me. So December was crazy. There were some weeks I was operating 4 days a week, and average was probably 3 days a week. I did enough cases in December, put it this way, to become board certified in a month. So by BFAS. So it's been a busy month. Mondays are today my big recon days where we do total ankles, customs, a lot of salvage, limb salvage type of procedures, total ankle revisions, fusions, non-unions are my Mondays. Wednesdays usually at our ASC all day. We run 2 rooms, usually between 6 to 10 cases a day. And Monday's at hospital, so it's usually 4 to 5 big cases. And then during December, it's usually we add Fridays, and then sometimes we add even Thursdays if we need to. So there were some weeks in December I saw patients 1 day a week, and the rest was all surgical with my fellow and my residents as well. Not something we want to do all year long by any means. I'm not a 35-year-old anymore. I am 55, so it does to wear away a little bit.
There you go. So you're from Colorado originally.
Yep, I grew up here.
And you had mentioned earlier you had a mentor in Colorado who really has helped guide your career. Do you mind commenting?
No, it's great. And it's something that I think all the DPMs should really think about doing. And I wouldn't be where I'm at right now if it weren't for my mentors. And the first one we'll talk about is Paul Stone, who was a residency director here at Highlands for a long period of time. And I met him when I was in high school. He was friends with my parents, and I was lucky enough to follow him around in college when I was trying to figure out what I was going to do in life. And I followed him around in college and spent some time with him. I'd get him in the morning, go with him to surgery, go to his office, and see what he was doing. And then eventually I decided to apply to podiatry school, and I applied to Shoal where he went. And I went through my DPM training. And, I wasn't that great of a student, to be honest with you. First year, I struggled. So I decided, all right, I'm going to turn this around. So my first year, after getting through, I would spend my summers with Paul. So instead of enjoying my summer sometimes or going, after my first year, I spent my summer there. And I stayed with them all month. And I'd come to the residency program. I'd go to their case conferences, journal clubs. I'd be there when I was in, just starting out in school. And I had him kind of focus me a little bit. So, he kind of kept me on track. And when it came time to apply for residency programs, obviously Highlands PSL was one of my top choices, but then I also was talking about some other programs. And back then we had non-CASPER, non-CASPER programs. And I visited Harris County in Houston and met one of my other mentors, and one of my closest, dearest friends I've ever had is Sam Mendocino. And it was hard to turn that down. And I actually called Paul because Sam offered me the program before CRIP back then. So I had a decision to make whether to go through an interview process or to take the program in Houston, which was a very highly regarded, high volume program back then. And Paul is one of the wisest guys I know. He said, Al, you get training, just get the best training you can. You can always come back. We can work together. It might be a good thing that you're training there to get a different perspective compared to, we call Highlands or PSL here, a lot of inbreeding because everybody stays. And there's a lot of, docs that come out here that all do the same thing. And it worked perfect because I ended up training down in Houston. I learned different ways of doing things. And when I came back to Denver and joined Paul and his group, it was very apparent I did things very differently. But not necessarily, it wasn't necessarily a wrong thing. It was a different way of doing things. And then we infiltrated. I brought one of my partners from Keith Jacobson, trained down in Houston with me as well. He was one of my partners for a while. And Kyle Hafner, who was actually a student who rotated with me when he was thinking about going to podiatry school. And he ended up going to the Iowa school and did Harris County as well. And he came back here and is practicing here in Colorado as well. So I think mentorship is very important. My MA is a first year at Kent. My old scrub tech is a fourth year at Iowa right now. So, one thing I would push as much as possible is that, if somebody wants to follow you around or you want to mentor somebody, it's amazing what you can do and amazing how much they can contribute to you. And, I owe Sam and Paul everything because they kind of guided me through this process. And they're both two amazing people. And like I said, I've known Paul since I was a kid, and Sam is probably one of my closest friends before he passed away, and it still is. And I took over presidency of GTEF as well, the overseeing entity over the two Houston programs. So I'm kind of helping manage them as well now and trying to help their education process. And it's nothing that, it's not like I don't have enough things to do, but I felt obligated for all the stuff that Sam did for me when I was going through this to make sure that his legacy is maintained and to maintain the high level education they need and to make sure everything's being done the way he wanted it to be done. So I find time to do that. That's important to me.
That's fabulous. Joe, your thoughts?
Yeah, Dr. Sam Mendocino was a huge impact on a lot of people. What was something that really, like, when you think of X, you like attribute it to him? I'm sure there are things in your day to day that you're like, every time he comes to mind.
So education wise versus personal life, there's two different roles. I spend a lot of time with Sam. So education wise is the way I try to develop thought process in my students, residents, and fellows. He was amazing at that, making you think and make you think through a procedure or think through a pathology, and not just to be a carpenter and learn to cut, but learn how to think and cut at the same time. That was the biggest thing he imparted upon me. And what I try to impart on my residents, fellows, and students is that anybody can cut. You have to know why, understand plan A, B, C, and D in your head. And one of the best lines I think I still use with my residents and fellows now is that, when you're doing a case and things aren't going well and things are going bad, have all your plans in place. Plan A, B, C. So when things don't go well, you're not throwing a fit. You're not getting frustrated. You just flow into the next plan. And it doesn't even look like you had a complication or an issue in the case. And the nurses see that, and you just flow through that. And by being prepared and understanding what your next step is without even having to think about it, makes you better and makes you a smoother and more efficient surgeon. And also, there's no reason to throw a fit. You just go to the next step and keep going. So that's one thing he taught me, and I've always used in my practice when I'm doing surgery, is that I already have the contingency already in my head. I plan for it to go bad. Luckily, it doesn't go bad very often, but I have the plan for that. And that's the biggest thing he imparted on me. He taught me how to think. And I think that's one thing that's lost in some residency and fellow and student education, is that they're trying to memorize, all the classifications or memorize a technique, but you have to be able to think about that technique and think why you're doing it that way. And I think that's been lost. And I think it's important to really impart that upon whoever you're training, is to teach them how to think and teach them, understand why you're doing the surgery. I think it's important. And Sam, in personal life, anybody who knows Sam is Sam. And he was almost like a second dad to me. So I talked to him probably on the phone 3-4 times a week, and we just chatted about life and how to just take care of yourself if you can. He was the worst at it, but he tried to make sure everybody was okay, and he had a big impact on my life and my career, and I'll always be thankful for him for that. And I can miss him every day, and we've got a lot of good friends from that. We travel the world together doing lectures and teaching and stuff like that. But those are great experiences I'll always remember.
Yeah, that's a beautiful gratitude moment to someone that clearly had such a big impact. And and I agree so much with what you said about, I talked to the students about this. You're not a proceduralist. You're being trained to think and to be able to understand the concepts behind what you're doing. It's important to have knowledge, because you have to have knowledge, but you really have to know how to think about what you're doing and the why behind what you're doing. So I love that you are sharing that as something that he taught you and continuing to share with residents and fellows too.
Yeah, I think it's the most important part of becoming a surgeon. You need to be able to think and know what you're doing and why. And I think a lot of students are so used to just memorizing stuff and getting knowledge, and that's what you guys are doing. You're imparting that knowledge upon them. And it's our job, is when they get a residency and fellowship, is to push that knowledge. They have the knowledge now, push their thought processes That's important.
Well said.
Mm-hmm.
As if you're not busy enough with practice and residents and fellows, Alan, you've had such a leadership role. You've been the president of both the American Board of Foot and Ankle Surgery and the American College of Foot and Ankle Surgeons. Where did you get those initial kind of seeds to make a difference outside of just the realm of practice?
Yeah, I mean, that started off in residency, right? So my first ACFAS was my second year in residency. And great stories, which I'll tell the ones that we talked about on here. But the second year residency, and goes, I need you to come to Florida with me because we're doing a lab with the Germans before ACFAS, and I need you to help me with the cadavers and help me with make sure everything's taken care of. I go, well, sure. Second year resident, I'm going to ACFAS with you, and we'll go do this. So, and that's where I met Tom Chang, Mark Hoffbauer, Byron Hutchinson, and I became friends with them ever since my first interaction with them. They were some of the best physicians and best people I've ever met. And I'm still close with Hoff. I still talk to him a lot. Tom Chang and I communicate and probably every month or two just to see how each other are doing. And it was when the point where I was a resident there in their practice, and they were some of the nicest people I've ever met. And I remember this is what really got me into wanting to give back long term. We spent the whole day in the lab with the Germans, and they're not easy sometimes. And I'm running cadaver legs back and forth, instrumentation, and we've been there from probably 9 to about 5 p.m. And I'm sitting there and I'm just like running around crazy. And Byron Hutchinson, one of our great leaders and great surgeons of our profession, comes to me and goes, "Hey Al, what are you doing?" I go, "I just finished cleaning up. I'm going to mess with this cadaver and do some dissection." I goes, "Oh, well, why don't I just teach you how to do some surgery?" I was like, it's like 8 hours. We've been just grinding, and Tom and Mark and Sam are going off to the bar and going to get some food. And Hutch goes, "I'll show you the procedure. What do you want to do?" And that's my first flexor digiform longest tendon transfer for flat foot. And he taught me the whole thing. And I used that knowledge from him, even in private practice. And those are the things those are the type of educators that you can't match that. So from that, and then from the kind of Sam kind of putting me in positions to start out. So when I got board certified in 2 years after finishing my residency. And Sam goes, "Well, you're done. You're board certified. We're gonna have you field test." So I took the ABFS exam that year, and then they had me field test that same year to field test the next exam. So I field tested, and then next thing I know, they asked to be on a committee. So then I started being on a committee, and then it started from there. And I always thank Sam for opening the door for me. And he always says, "I'll open the door, but you have to do the work." And I tell that to my residents and fellows now, if they want to be involved with the college or with the board, that I'll open the door for you, but you got to do the work. So I started doing the work, and I enjoyed it, and the camaraderie and the education, and it just kept on snowballing. And I met some amazing people all the way through, from not only just physicians, but also staff that have been great. And I always remember like Mary Myers at ACFAS, and Carl, the front guy at ABFAS. He used to greet us whenever he came in. One year, and it was a long weekend, and he had Red Bull waiting for me for the next morning when we were getting ready to do our meetings. So some amazing people and things I would never give up. And it's great just seeing that. But I think the door was open from Sam, and he always pushed me as well. And I have to give him that. And I just kept on doing it and enjoying it. And I think maintaining your knowledge base and your thought process is important. And what a better way to do that than to make exam questions. When I chaired the oral exam committee when we had orals back in the day, developing those oral questions is thought process, right? Thinking through a case when it goes bad and doing all those things. So I think that helped keep me on top of my game all those years. And I know I've talked to a lot of my colleagues. I don't even know, they don't give back to any committees or anything, and they can get lost in the shuffle of just practicing and doing their normal thing. But it can be hard. It's a lot of time commitment. And, I bless my wife. She's awesome. And she understands when I have to go to a meeting or go to a board meeting, or the college has something has to have to go to. it does take a lot of time. So it's a hard balance. And to the younger practitioners out there, balance is hard, but but you still have to give back. And your skills have been honed and you've been educated, and it's your job to do that for the next generation.
Well said. So
Yeah.
let me ask you this: was it the same kind of process? You're on the train tracks and you're not going to jump off, because you go from president of ABFAS to American College of Foot and Ankle Surgeon Board. And I mean, it's incredible, and your willingness to give back seems to be unending.
So I started, as I was doing ABFAS track, or essentially, I was chair of the oral committee and oral exam committee back in the day. And they asked me to move up, and I didn't want to. I said, no, I'm not ready. I think I was ready. So I became president of ABFAS 13-14, but I started with them in 2003. So I waited a while and finally joined the board. But during the whole time, I was also on Education Scientific Affairs Committee for ACFAS. I did that for a year and a half, and I chaired it. I chaired that for 2 to 3 years. Then I moved from there to Skills Committee. And I moved on to Skills and chaired that for 2 years after being on it for like a year and a half. And then when I finished Skills, I went to the ASC. And this is the same time I was doing ABFAS. So by the time I was finishing up my presidency in 13-14 for ABFAS, I was just moving into the chair position for the ASC for ACFAS. So I did that, chaired San Antonio and New Orleans, and then was on the committee for a few years. And then from there, that's when I just ran for the board and got elected, and just kept going. And it was seamless. At the same time I was doing that, I was still doing committee work for ABFS, which I'm still doing now, as for the lead and continuous certification. I'm still doing that committee as well, and the exam oversight committee. So still doing both sides, and it's just kind of what I'm used to, I guess.
Love it. Joe?
It's like you say, Jeff, if you want something done, you ask a busy person to do it, and they'll get it done.
Always.
And fun fact, Alan, your signature is on my ABFAS certification. So it's funny, like sometimes how these connections kind of go. But I'd love to take a quick moment to talk about FC. What was that?
Joe, you know what's really funny?
What's that?
I signed my signature on my own recertification certificate. I signed my own. Yeah, so I signed my own research.
That's really awesome. It's like, yep, I'm just going to certify myself.
That is funny. I like that.
I'd love to take a minute, though, to talk. We have the ASC coming up for ACFAS actually in the next couple of weeks. So I'd love to pick your brain a little bit more about that process. You are the current president for the American College of Foot and Ankle Surgeons. What has been the biggest thing that you've learned this year in the president role of ACFAS?
Lots of calls, lots of discussions on a lot of things going on in our profession. Politics, I was used to. I was used to the politics from ABFS, but this is more so a different type of politics. And I've learned that things are, and we talk about evolution, right, over the years, and we worked so hard to get where we're at. I mean, I remember stories from Sam telling me where you couldn't even write a prescription in the hospital. You couldn't operate in the hospital back in the day. And they've worked so hard, ones before us, to get us these privileges and to show that we know what we're doing, and to get certification done, to show to our colleagues that we are, certified and we know what we're doing. And the biggest thing I've dealt with this year is politics of, how do I phrase it? Just people want to do things without putting the work in. And, the number one, the motto of ABFAS is to protect the public and to make sure that, when certification occurs, that they've been vetted not only before with the didactic exam and CBPS, but also, post, finish your ABFAS CBPS exam and your didactic, now you're collecting cases in case review. And so showing that not only did you do okay in residency, but now when you're going out there, that there's guidance on, checking your work, I guess you call it, right? And making sure that you're doing the work appropriate for a board certified physician. And unfortunately, that's kind of gone by the wayside in some parts of our profession where, people are using our non-surgical side of profession to get surgical privileging. And I understand some of the arguments that we're all doing the same residency programs, we're all doing the same 3-year programs, but you still need to be vetted. If you look at orthopedics, they have a collection period where they collect cases for 6 months and they are examined on those cases. There has to be some post-residency or postgraduate vetting of the surgeons to make sure they're doing everything appropriately for the public, to protect the public. And unfortunately, some people are trying to circumvent that, which makes it difficult in our profession to move us forward like we have over the last 20, 30 years to get where we're at. And now we're taking a step back. And that's problematic in the fact that, the future of this is difficult because we want to make sure that the public is protected and the board certification means something. And if you're getting a surgeon that isn't board certified or not board certified in surgery, are you getting the best care you can possibly get? And are they misleading the public in a certain way, saying they're board certified, but they're board certified based on CPME guidelines on the medical or non-surgical side of our profession. So there's some difficulty in that, and the politics with that, and a lot of hours going into dealing with issues that we really shouldn't be having to deal with. We talk about also this recruitment crisis and students. Recruiting students understanding our profession is important. Every time I have a student come by or a scrub tech or an MA that goes to school, it's because they see what we do. And I saw what Paul did way back when I was in high school and college, and that's what got me there. And I think our identity is mixed, and we need to really get our identity out there. And I know, Jeff, you've been amazing in pushing that forward with all the stuff that you've done in the initiatives. That needs to be continued, on a grander scale. There's just too many elephants in the room sometimes, and we need to get around that somehow. So the politics is probably the hardest thing I learned about this year, being president, is managing that and making sure that we're all taken care of and the profession is taken care of. And that's the goal of the college, is to educate, and to our sister organization is ABFAS, and we want to make sure that the quality is continued to be out there and improved and not decreased, I guess you call it. So that's
it's interesting.
Soapbox.
No, I love it. It's interesting, Alan, because, if we talk about the school, everything we do is student-centric. We do it for the student. But as a profession, everything we do, we should be doing it for the patients. And I think that's a fair enough analogy to talk about some of the challenges we're having in our profession right now. But thank you for spearheading a lot of that. I know it's not easy, and I know that working with PJ's got to be great. PJ's incredible.
He's amazing. He's done an amazing job with the college and taken over from Chris Mahaffey, who was there for a long period of time and did a great job. But he's just really come in strong and really understands what our profession is and what our surgical side is really doing, and really understands that the quality that comes through the college and ABFAS certified surgeons. The quality is there, and that's what we're trying to continue to push. Our ASC, perfect example. You see a lot of the meetings from our other colleagues, whether it's orthopedics, whether it's other parts of our profession, I guess, and their meetings are not well attended, and they're struggling and to be successful. But yet the college is going strong. Our registration's ahead of last year already, and we have international speakers. We have our local speakers, our regional speakers, and we have MDs, DPMs, DOs. We have them all coming in here. And our meeting every year grows and grows. And it's a testament to what the college is trying to do to continue the high level education and continue the camaraderie that you see all your buddies there from school and all your colleagues from residency, wherever it may be. And you get together and you spend all day listening to debates and discussions and what's new out there. And then you go out and have a great time, and especially in Vegas. Oh goodness, it's gonna get ugly, but it'll be fun. And it's a great experience, and every time I go to an ASC, I learn something. And it's harder these days being president on the board and all that kind of stuff. Because we don't really attend a lot of lectures, because we're doing meetings with industry, we're doing board meetings, we have our agenda is pretty tight. But this year I'm dropping the mic. After this year, I get to do whatever I want. So I'm going to do it myself, but it'll be interesting.
Well, this year on Wednesday night, if you're free, the Arizona College is doing a friends and alumni party. You're welcome to join us all.
Well, let's stop by for a drink and say hi for sure. But yeah, it's so exciting. The ASCs are exciting, and just seeing them grow. And Mike Dugella is the chair, is an amazing job with the international faculty. I mean, the discussions with some of the guys from last year, I think one was from Thailand, on the same panel from a guy from like the UK, on a panel with some of our subject matter experts in the States, and the debates and discussions. It's impressive, the different thought processes and the way they think about how they address things. In South America, you can't use certain types of allografts. You have to use autografts. And every country is different. And it's amazing the different things that you learn and see. And I've had the pleasure of doing some mission trips with Mark Meyerson's group. I went to Brazil and I went to Chile and operated with surgeons from around the world and saw how their health system worked, and did some work with those guys and lectured to the local physicians. I mean, it was amazing. Those type of things are opportunities that are opened up to us that would never have been open to us in the past. I remember when I first met Mark back probably 15, 20 years ago, and we chatted, and so eventually, Al, you and I will be working together on some things down the road. But right now, things are still in turmoil. It was. And next thing you know, down the road, I get a call from Mark, and we've always been cordial and had some good discussions. And Al, would you like to join me on one of these things? I'm hey, sure, why not? Let's do it. And it's been great. So things have really changed in the world of foot and ankle, and I think for the better. And I just hope we just keep on moving forward with that, with the younger generation coming up and maintaining the excellence that we need to maintain.
We all know that early detection is the most important determination in improving patient outcomes. Bako Diagnostics remains committed to supporting you in your role as the first line of defense in diagnosing lower extremity pathologies. Bako Diagnostics, helping podiatric physicians keep America on its feet.
And I think that's exactly it, Al. Excellence is the pathway to acceptance. And our profession has made so many incredible strides over the last 10 to 15 years that it's only going to continue because of that excellence, that mindset of excellence. But to your point, we have to maintain that integrity. And so I really commend you, the board, the ABFAS board, for continuing to stand by standards and maintaining professional integrity, because board certification does stand for something. And when Jeff and I interact with students, they want to know that they're working towards something that is excellent. Everyone wants to achieve that. So we just need to keep moving in that progression, because to your point, the rest is noise, and the noise will do whatever it's going to do. But we as a profession are going to continue to move toward excellence. And I love go ahead.
That's so well said. I mean, there's nothing. The only reason we got where we are now is because we've shown what we can do and how we educate and how we've evolved. And, I'm on multiple design teams where we design equipment with our MD colleagues. 20, 30 years ago, that would never have happened.
Yeah.
We're our own worst enemies at times. Our own profession, we are our own problem. And it's I hate to say it's a lack of work ethic and a lack of wanting to become excellent, right? And you're right. And I love that you guys are teaching these students and pushing them to be excellent. That's important. Our own profession doesn't enforce the problems that we're dealing with. And, I can go into all sorts of issues with, our overseeing organizations, but they have to step up. They have to do something. They have to enforce the bylaws that are in there, and they have to enforce the guidelines. If you don't enforce the guidelines, you are a lame duck organization. People are not going to respect you and not going to follow through with things they have to do. So somebody has to take a stand. And unfortunately for us, ABFS finally is fed up to the point where this can't happen anymore, and they're taking a stand. I'm not going to name names, but the other organizations need to take a stand too. And that's the problem.
And you're right, because united, when we all collectively stand together for excellence, we are our worst enemy. Dr. Steinberg talks about this, that I think I think he was the one that quoted, there was a general surgeon that said, "You guys are incredible. I don't know why you get in your own way," or something along those lines. And so to me, it is one of those kind of tumultuous times, but I also see so much opportunity, and I see just tremendous potential in the incredible work that people are doing. And so one of the things that I'm really the most excited about with the ASC coming up, the panel, to your point, there's a whole sports international. Like I know they have some trauma international. I mean, it's incredible to have this collaborative international effort that we are a part of, that we are being welcomed as being part of. And that is because of the hard work and the dedication and excellence. And so again, I think that moving forward, that those are the things that get me really excited. And so you had mentioned, I have down in here the stuff about the Steps to Walk program. I think that's what you were talking about with the international working groups. Can you talk about how you got involved with that? Because that was definitely something I wanted to ask you about.
Yeah, so that was with Mark Meyerson, who is retired, who's actually in Colorado now. And he and I have known each other from Sam way back in the day. And I just remember having conversations with him at a dinner meeting we had one time. And, we always talk about our controversy with MD and DPMs and how, he used to be a very anti-DPM back in the day when he was at Union in Baltimore. And we talked back and forth, and we goes, eventually we will be, doing stuff together. It's just the timing is not always there. And I go, I totally understand. I get it. And I remember, Mark, I appreciate everything you do. And I know you're, working a lot of industry stuff that we deal with. And we chatted. And this was probably, God, I was just in practice. It was probably like 2005, 2006-ish in that time frame. And then we've always been cordial and seen each other and discuss things here and there. And then Steps to Walk started when Mark retired, essentially from surgical practice, and he moved out to Colorado, and he started doing this. He always came up to me and he always say, "Oh, you know what? We were given a great gift of knowledge and able to do the surgeries and these gifts to to do these things for people to help them walk when they never could. And it's our job to give back to the world, not just our profession and not just to our local community, but for everybody." Right. And there's so many places around the world that are just so underserved. And, given the 2 places I've gone so far, not as desolate as some of the places he goes. I went to Sao Paulo first, which is a massive city in Brazil, with him. And the second one, I went to Chile, and he couldn't make it because he had some medical problems. And I went with 2 other surgeons. One other surgeon headed up from Chile, and then 2 other docs from the States, and 2 MD orthos that we worked together. And I still remember the first one when I was in Sao Paulo with Emilio Wagner and then Rahil Sharif from the UK. And Emilio's in Chile, and Rahil's from the UK, but it's actually in Dubai or UAE back then. And we're going in, and everybody's skeptical when we first look. Everybody's kind of sizing each other up when we're in there. And, because obviously we don't know each other. And I was the first DPM to go on any of his mission trips. And I went there, and Mark was there, and we were chatting, and we have lectures, and then we teach, and then we go to surgery, and we eval and triage and schedule for surgery. And you can always see everybody's kind of watching everybody's surgery and see how they're doing. And we're all said and done. We're all eating and drinking together, and goes, Al, we were skeptical at first. We don't know what to take on the DPMs, but you do it the same way we do. Yeah, it's pretty similar. So then we became friends, and I'm still friends with them now. And we operated together in multiple surgeries, and then took a year off. Then went to Chile with Chris Gross, Ariel Palanca, and we were down there. And Mark unfortunately couldn't make it, but we still went and did what we had to do. And the same thing is like, again, the MD side's like, I don't know, let me check who is this guy, and what do they know? And we all worked together and operated together, and there was no more MD DPM type of divide. We just treated patients and did what we had to do. So, and do it for patients who don't have access, and it was amazing. The patients were so thankful, and we round on them afterwards and before we left, and taught other physicians there, and we were able to work as a team together, and it was a great experience. And kudos to Mark for doing that. I mean, the amount of time and effort he puts into that is very impressive. He goes all over the world and gives his time, and And he's an amazing surgeon, amazing educator. And it's always just an honor to sit there and just listen and chat with him and just talk about our profession, surgery, and life. And he's an amazing person. I know a lot of people in our profession had some, a lot of older guys probably had a little bit of animosity towards him. But that was just the culture back then, right? I mean, we all change, and he's one of the nicest and brightest guys I know. And we all change, and that's why I always keep an open mind when I meet whether it's a MD colleague, DO, DPM, international, national, whatever it may be, and just once you start working together and they see what you know and what you do, all those barriers usually go away. And that happens on our design teams as well, designing equipment, designing implants. Everybody's skeptical first. Everybody's sizing everybody up. So who's on the design team? Once you start getting them down to working together and doing stuff together, you just try to do the best you can to make the best product you can. So I think that's important, that, always keep an open mind. And I don't really hold grudges. So, if somebody was bad to a profession in the past, what are they now? Have they changed? Are they different? How do they receive our physicians and our profession in general?
Yeah. Yeah. Again, being themes, Jeff, of excellence, right? You show up and you just be you in your excellent, like what you bring to the table individually in your best form of excellence. And that's what builds these relationships.
Yeah.
And it takes guts, though, Al, to sit across from a panel of people that you kind of know are sizing you up. And so I'd love, Jeff, I'll give you the ball in just a second, because I have on here, one of the other things I wanted to ask you about was some of the consulting and medical advisory boards, because you're a part of a lot of them. But how did you get started with some of that? Because again, it can be a little intimidating to figure out what to be involved with, what to say yes to, what is taking up a bunch of time, but isn't really giving you the kind of reciprocal improvement that you're looking for. How did you make those?
That's a great topic. And I have a philosophy about this, and I'll tell you my philosophy in a little bit. So I started doing my first medical device or industry consulting probably back in about 2007-ish with OrthoHelix back in the day, and which was acquired by Tornado, acquired by Wright, acquired by Stryker, all the way down the road. And I'd always said I was never going to do that because, you're tainted, you're biased, and all those kind of things if you're designing equipment and you're using the equipment. And I had my first experience designing some. We designed a hammer toe implant, designed a mini frag set, and all this stuff. And when I start looking at working with industry, I will not consult or design for a company that I have not worked with as far as their hardware in them, and I use it. A company came up to me recently and asked me, well, will you teach this course for us and do this? Well, I want to use your equipment once. He goes, well, that's okay. We just want you to teach. I go, no, that's not really ethical. I have to be somebody that knows the equipment, and I believe in the equipment, believe what I'm doing. So yeah, you can make a lot of money in consulting and doing that kind of stuff, but it's really easy to lose your ethics in that regard. So that's very difficult. So my philosophy when I'm dealing with industry or consulting is, one, if it's a company that wants me to teach for them, I have to have used their equipment at least for a few months and have done at least a dozen plus cases with their equipment, and I have to believe in the equipment for me to teach for them or to give a lecture for them. Okay, so if I'm not using your equipment or I'm not believing in equipment, obviously I'm not going to do anything with them. So that's my first philosophy. And two, the way I look at when I did my first design, it's because it was a needed role of a device that wasn't there before, right? The hammer toe implant we used was a different type of design, different thought process, because what was out there before wasn't working very well. So that's when the oldness in me comes out, right? So I'm doing surgery and I see something that's not working well. Well, how can I make this better? So whether it's total ankles, whether it's intermedullary nails, whether it's plating systems, whether it's a device, or even biologics, where it's something biologic to enhance healing potential. Those are all things that come about from just doing surgery and seeing where the deficits are. And getting involved with industry, I think, isn't twofold. It's one, it's your desire to do it, but two, you have to be legitimate, meaning that you have to done the cases. You have to understand the reason. And they see it. They see it when you put the work in and you know what you're doing and you understand because you know the product forward and backwards, whether it's a total ankle, whether it's a nail, whether it's plating system, whatever it may be. You have to be knowledgeable and have an experience with it and understand and be a subject matter expert, right? You have to understand, you have to have that credibility. And you know how you get the credibility? By giving back to the profession. Volunteering on committees, volunteering on boards, volunteering for the college. You don't get paid for any of that. When you get paid, you don't realize you're getting paid. You're getting paid by keeping up your education, giving back, educating other physicians or students or residents. By doing that, you are getting paid by recognition and being known as a subject matter expert, right? Because if you're on the panel talking about Liz Frank fusions and you do it this way, and then next year you decide, well, I'm gonna make it better. I'm gonna design something for that. You did that because you're on the panel and you understand the procedure and understand how to make it better. So the only way you get credibility in our profession is you have to be exposure, right? You have to be out there teaching, training residents, teaching fellows, giving talks, doing a talk at the ASC, teaching a skills course, teaching residents are now maybe across the country, but they know that you do this procedure and they go, well, I want Dr. Ring to come out and do our state meeting. You know, by giving back and teaching and being exposed, people say, oh, I don't have the time to do that. Well, you need to make the time if you want to move up and be exposed and be sought after, right? So that's kind of my philosophy with industry, and it does take time, and it does, but it's gratifying in a way because it's another way to reach out and educate other people in our profession. Meaning that sometimes they may want to put a course on with whatever it may be, what equipment it may be, and it's like, and you're teaching somebody who hasn't really used that equipment or has not really done that procedure. I've had people come to those courses, stay afterwards. Hey, would you stay and show me how to do this, this, and this? Well, sure, I'd be happy to. And being open and I think of Byron Hutchinson every time somebody asks me something about that. It's like he took the time to help a second-year resident who, after 8 hours of grinding it in a cadaver lab, would spend time when his buddies were out drinking and eating already to spend time with a resident to teach them how to do a surgery. So anybody that asks me, whether it's a student, resident, fellow, another colleague of mine that needs help on something, yeah, I'm going to take the time and help them. So that's something that you'll always remember. And it's giving back to the profession, it's giving back to the college, giving back to the board, whoever it may be. I think it's important. So that's kind of my philosophy.
Yeah, no, I can appreciate that so much.
Mm-hmm.
Jeff, your thoughts before I jump more.
Well, I love that philosophy. And you're the epitome of, if you want to predict the future, create it. I mean, I just love it, Al. Those are just wonderful. I think students need to hear that. I think residents need to hear that. Just a phenomenal philosophy. Thank you for sharing. Joe, I have one more question. Want me to go, or do you want to finish up with yours?
No, I'll let you go, because then I do want to do a couple rapid fire. We got to find what makes Al Ing tick at the end.
Oh, yeah.
Well, one of the things I wanted to give kudos to the Colorado podiatric community. Al, I was there, as you know. I practiced for 17 years. Just an incredible podiatry community, going back to the days of Highlands and Dr. Buchholz and Dr. Stone and Dr. McGarry. I mean, it goes on and on and on. Do you mind making a few comments about podiatry in Colorado?
Those guys are amazing. And those are all legends. And Jack McGarry, you're gonna laugh. I got a great story. And this is a story I always love telling Jack, and he laughs at me every time I say this. So I was a student with Paul. I'd go to all the journal clubs, all the case conferences. And McGarry was the director back then. And he was so intimidating. He scared the living hell out of me. I'd go to journal club or case conference, and he would grilling the residents and go, this guy is hardcore. This guy intimidates the hell out of me. I don't usually intimidate that easily, but he intimidated the hell out of me. And then I got to know him. He was president of ACFAS as well. And we worked on multiple committees together. And I got to know him and go, Jack, you used to scare the hell out of me when I was a student. He just laughed at me. He goes, yeah, I remember you coming around. You'd always come around and follow Paul and come follow the residents. And I couldn't believe you'd spend the time in your vacation to spend time learning. I go, I didn't have a choice. I had to get through school. I had to pass. I had to learn more stuff. And he would just laugh at me. And when I came to Colorado in '03, when I joined Paul's group, Jack was the first one to welcome me. He would send me patients and we would talk. And I'd always say, you used to scare the hell out of me, Jack. You used to intimidate me. He just laughed. And he was a great guy. I mean, the community here in Colorado was great. Not just DPM, but MD also. We have a lot of good colleagues that we work together. I currently work with the Institute for Limb Preservation here at PSL with the Ortho Oncology Group, the Limb Pres guys. We call ILP. We do conferences with ortho oncology for our big reconstructive cases and put our stuff together. Dan Lerman, Raul Goste, Zeke Walton. These are all the hardcore, oncology cancer guys. And we are in the same room with them and we show cases back and forth, ask each other advices, and we operate together now as well. And so my fellow and I, we work with them and operate times together. So, I mean, it's the evolution of our profession, right? That would have never happened, years ago. And same with Dave Hahn, who he was a dear friend of mine, and we practiced together. And we're different groups, so we operated together for close to 7 to 10 years. The last part of his practice, before he retired, we would operate together, and I would put a total ankle tibial component in. He put a total talus in, or recon cage, and we worked together. He worked with our residents. He was one of the most well-regarded orthopedic surgeons in Colorado, and our residents rotated with him, and he was amazing to us. And I remember, we're just working with him was great for the residency itself, but also, developing my practice and learning from each other. And he's another one of the guys that was, he's retired now, but he was an amazing surgeon to work with and was a real advocate for our residency and our profession here at Colorado.
This kind of ties right in. When my mother needed a bunion surgery, this is like 2005, something. I called Paul. I said, hey, Paul, Paul Stone, you do my mom's bunion. Turned out he was on vacation or something. So I called Jack, and Jack's like, of course. He goes, are you going to help me with it? I said, nah, she's coming to my house afterwards. I'll take care of her post-op. You do the case. So it's all good. All right. Colorado's phenomenal. So thanks for all you do, Al. All right, Joe, let's do some rapid fire.
Yeah, let's do it. These are the fun kind of rapid fire. So I want to know what kind of music Al Ing listens to in the operating room. What's your playlist?
So it depends on the type of surgery. Typically, it's Hair Nation, kind of 80s, Def Leppard, Poison, Motley Crue. That's the standard. If it's a bad case, that's pretty hardcore. Sometimes I'll do a little Godsmack or Shinedown, a little more harder music. Usually when my fellow's with me, sometimes he sees I'm a little high strung, they'll put in some, what's it called? Some like reggae-ish type music, try to mellow me out sometimes. So when sometimes a fellow and my script will change the channel on me if I'm going a little crazy.
They figured out the psychology of how to tone you down a little bit. I love it. I'm definitely very influenced by music, so that would work on. Yeah.
All right, Al, non-podiatry vacation. Where are you going?
Like a rest vacation or?
Well, there's kind of two different kinds of vacations, right? Yeah, you're right. Rest versus going for it. Both.
So for rest, I don't really rest. So I just went to Japan this last year. I'd go back there in a second.
For sure.
Because the culture is amazing. And the food's amazing. And obviously, I like to eat. So that culture there was eye-opening to me. I'd go back there in a second. For quick little breaks to unwind, I'll go to Vegas for a weekend and just blow off some steam. And I don't know, people don't really relax when they go there, but for some reason, it relaxes me. So I'll do that. Those are my two main ones, probably Vegas, and I'd love to go to Japan again.
I was in Japan for a week and I didn't use utensils. It was chopsticks, and I couldn't keep up with the locals on the sake, though. I just couldn't keep up with them.
Oh, that's amazing. That place is unbelievable.
It is unbelievable. Do you go to Kyoto?
We went to Osaka and Tokyo, but the way they respect each other is something that I think we miss here in the States, and it's impressive there. So
fair.
Love that.
Your turn, Joe.
All right. So we'll stick on the food option. If you could pick restaurant anywhere or any kind of food, what kind of food would you eat?
Oh, I go everything from just great chicken wings. I love my wings, or if I want some high end, a good steak. You know, here in Colorado, I go to Garden Grace a lot. One of my friends is the owner of that restaurant, so I'll go there. And usually, we have our case review for ABFAS. I bring the whole group. We go there and eat and drink and enjoy ourselves. So
There you go. All right,
I'm
so
just
next
as
time I
good.
see you, I'm going to bring you chicken wings and a Red Bull. That's what I've gotten from this interview. So, all right,
That works.
your turn,
That works.
Okay, Al. Colorado mountains, summer or winter?
It used to be winter until my body broke down. The knees are bad, the back's bad, shoulders are bad, neck's bad. So it's not really skiing much anymore. So summer.
Oh, okay. What do you like to do in the summer in the mountains? Or where do you like to go?
Just golf, relax, hang out. But I'm not a huge hiker. Obviously, the knees don't hold up anymore. So he's just golfing and just if we're going to the mountains, use golf with friends. That's about it.
So beautiful.
Yeah.
I'm the same way. I used to ski when I was younger, and then I just burned out.
Got beat up.
Yeah, and also I'd take my kids and I'd be like, "Well, where's their gloves? So what happened? Where's that extra sock? Dad, I had it on earlier. I don't know." You know. So all right, Joe, you have a last rapid fire.
All right. So this is one of my favorite questions. If you could invite anybody to dinner from any time period in history, could be personal family member or somebody famous, who would you invite and why?
Anybody I can invite to dinner. Mm-hmm. Who would I invite? This kind of, who I invite? Sam. I bring Sam back. That's who I bring back. I'd love to sit down with him and have another dinner and just chat with him and philosophize about life. Yeah. I mean, you have your mentors, right? And your mentors that have given a lot to you, and those are the people that I would always spend time with, rather than some random, president or some random politician or some famous person around the world. My famous people are people around me. So that's what I do.
Well said. Well said, Al. Joe, any last comments?
No, I think that was a beautiful mic drop moment. We're just going to let that rest.
I agree with you. Thank you so much, Al, for joining us on Dean's Chat. Just a fun. It always seems like 10 minutes go by and it's an hour.
Oh, geez, is it? Oh, God. Appreciate it, guys. Thank you guys for everything. I'll see you guys at ASC, right?
Yep. Oh, absolutely. Yeah. Al, we're going to be sending you a Dean's Chat mug.
Awesome.
You're gonna have to put your Red Bull in something.
Yeah, we'll do that.
Morning
it'll be on the podium with me when I'm up there.
There you go.
There you go.
I think I only have one panel this year. They kind of keep the president's schedule light, but I'll bring it up there with me and put it on my panel and debate for you.
Oh, that's fabulous. Well, thank you.
Guys.
Well, to all of our listeners out there, if you're listening on Apple or Spotify, please give us a 5-star rating and leave a comment or two. And if you're watching on YouTube, by all means, become a subscriber. Joe and I will continue to bring leaders in the podiatric profession. Al, you certainly have given back so much over the years, and we appreciate you giving your time at the end of a long surgery day also.
Thank you, guys. Appreciate you guys both. Thank you so much. And we'll chat soon, I'm sure.
I look forward to it. Cheers, everyone. Bye-bye.
Cheers. Bye-bye.
Bye.